Today we're hosting a pain summit on the University of New England campus, and it includes all kinds of experts in clinical and basic sciences, as well as health policy advising, policy making, advocacy work, and certainly education too. Chronic pain is a major health problem that affects roughly a third of our population. It's depleting resources and direct and indirect medical costs, and really derails lives. On the flip side, we also have substance misuse, abuse, and addiction to a variety of different substances, but in particular we have had a lot of focus on the opioids.
We spend over $500 billion a year in the treatment of chronic pain. That's more, by the way, than diabetes, heart disease, and cancer combined. And so, why am I here to talk about pain? Because it's probably one of the most important questions, the most important problems in society today.
I think Dr. Bilski is to be commended, University of New England's to be commended for bringing in people who can speak about the narrative from the patient's point of view, as they have. How do things look from a drug regulator's point of view, rehabilitation specialist's point of view, as well as a laboratory scientist?
It's been, I think, a lot of misconceptions about the idea that chronic pain is just pain that has persisted for a period of time. And that we're only now just beginning to understand that it is really much more complicated than that.
For all of us who deal in the government side and the regulatory side, sometimes when we see a problem growing, as we have seen with the opioid crisis, there's a rush to, fix it. And our constituents want us to find an instant solution. And you come to a conference like this and you realize that, it can't be just one solution.
This is an incredibly exciting time right now. We're seeing a convergence of the science, that are discovering new technologies, new mechanisms behind pain that are getting translated then into safe and effective treatments. We're seeing, I think at least as importantly, people coming together.
As the research that's being done here at University of New England progresses and new targets and pathways are discovered, it's likely they won't involve opioids at all. So one day the controversy around opioids for pain may be a non-issue because one day they may be obsolete.
We feel like we are shepherds in groups that can bring together outside interests, including the public that needs to be engaged in this dialogue, and we also want to include policymakers and insurance companies and medical health care systems. That's, I think, one of the things that a university can and should be doing, and UNE is at the forefront of this.